Okay, this is a quick video just to go over a couple of the key points that we talked about the last day. The main 2 points were how to contract the pelvic floor to 20%, and the other was how to find neutral pelvis. So when we're doing these exercises, we have to be able to do them by contracting the pelvic floor, and we have to do them in a neutral pelvic position. So the pelvis itself is made up of 3 bones, 2 innominate bones here and the sacrum, which is in the middle, and the pelvic floor is at the base of the pelvis. So basically, as the name suggests, it's at the floor of the pelvis, so just down here. So this muscle is a muscle that basically kind of best described as the muscle that stops you peeing mid-flow. So it might sound silly, it might be something you want to try at home, just to get the sensation of how this muscle works if you're unsure that you are doing it properly. So now we're going to have a go at how to contract it here. So I want you to basically place 2 fingers on your pubic bone and another 2 fingers back here on your tailbone. And as we breathe in, you're going to bring the 2 points closer together and draw them slowly upwards. So as you breathe in, gently contract the muscle, and as you breathe out, totally relax, and you should feel the muscle totally relax and drop. So as you breathe in once more, you should feel the muscle drawing kind of gently together and upwards. And as you breathe out, you'll feel the muscle drop and relax. So keep practicing that, maybe do 8-10 breaths in, just contracting and out, relaxing, nice and slow and nice and gentle. As I said, we only want about 20% contraction. It's nothing too, not looking for a maximal contraction, just 20%. And keep practicing. The more you practice, the better you get at it. So if you are having trouble, try the P trick, and that'll give you a good idea of how the muscle works. The other one was how to do the muscle or do the exercises in neutral pelvis. So with our pelvis, when we rotate it, we're gonna, if we rotate one way, we're gonna end up with an arch in our back and our bum sticking out, and kind of elongated muscles here in the front. So arch in the back, bum out, and when we rotate it the other way, we're going to have, let's say, bum tucked in and kind of a flat back here. So if you look here at the pelvis, so one way, rotating that way, we end up with an arch in our back. Rotating the other way, we're going to end up with a flat back. So I want you to place, basically, we're going to get your hands and we're going to place our fingers here on the crest of the ilium. So on the crest of the pelvis here. So basically our index finger should be kind of on the tip of the crest. So you feel that point here to come up along. You'll feel it yourself. Actually, a bit lower here. Stand up. You should feel it here. So tip here, and you feel that's where the crest of the pelvis is. So as we stand up, like so, if we rotate this way, we're going to rotate first, we're kind of rotating that way, hands in the pelvis, rotating that way, you'll notice that your bum sticks out and you have a big arch here in your back. So that's called an anterior pelvic tilt. That's all the way rotated one way in an anterior position. Anterior basically just means the front, and when we rotate backwards, that's called a posterior pelvic tilt. So when you reach all the way one way, your back should be pretty flat, you're kind of bum tucked in, and that's called a posterior pelvic tilt. So I want you to get used to finding all the way one way, all the way into an anterior pelvic tilt, and all the way the other way into a posterior pelvic tilt. So it's good to do these up against the wall. When you do it, you don't want any swaying going on. So if you do it against the wall, that'll stop you kind of swaying the stomach or swaying the upper body. It's all mainly coming from the lower part. You will get a bit of movement up here, but most of the movement is coming from the pelvis as we rotate one way. So rotating this way, that's going to give you bum out, arch in the back. That's the anterior pelvic tilt. And we rotate the other way, that is the posterior pelvic tilt. So that'll have the flat back and your kind of bum tucked in. So do that against the wall. Using the wall or doing it on the floor gives you great feedback. So it gives you an idea of where your back is. So when you do it against the wall and you kind of tuck all the way the other way, when you put your hand back there, you have big space between let's say the wall and your back, and you get to fit your hand in there, and we rotate back into posterior pelvic tilt, so rotating that way, you're going to have no space between you and the wall, so when you try to put your hand in there, you won't be able to get it in. So trying to find 50-50, so you get used to going one way, all the way rotated that way, all the way rotated the other way, and you just want to find where the midpoint is. So that's where we're going to perform all our exercises. So you just have a nice kind of small curve in your back, and you'll be in a neutral pelvic position. So that's the best position to do all these exercises in. And as I said, try that against the wall, and try it maybe, we'll do it on the floor here in a couple of seconds, I'll show you how to do it. And just keep practicing that. So it's just very important that we be able to perform those exercises in that position. So now we're just going to maybe look at 3 or 4 exercises, so you can practice them. You can just stall the video, pause it, and do it one by one, and maybe over the next few nights maybe practice for 10-20 minutes and try and just get a bit better at it so we can progress to the next step. Okay, the first exercise we're going to do is called the quad position, which is also known as the cat camel. So basically for this you're going to go on all fours. You're basically going to have the knees underneath the hips, so you're not going to be leaning backwards. Knees underneath the hips, straight line down, and the wrists underneath the shoulders. So if you were to look from the side, you kind of have a nice kind of box position there. Okay. So I'm just going to do a couple of reps of this, and then I'll just talk you through it. So breathing in, arch your back up towards the ceiling and drop your head in. This is all done in a fluid motion, and as you arch your back up, you also drop your head at the same time. So I don't want you arching up and then dropping your head in like that. From the start you just go one fluid motion. So you breathe in, and as you breathe out, you drop your stomach towards the floor, and you kind of arch your back and stick your bum out, okay? And you also bring your head up. So when you're up here, you're in that position, and when you come down, you're slowly lifting your head and you're sticking the bum out, and it's all done in one fluid motion. So I'll just do 2 more reps. Okay, so that's a nice exercise just to get a bit of movement into the back, kind of arching the back and dropping it the other way, and getting the sensation of how your back moves. So the next one we're going to have a look at is how to find 50-50 on the floor. So we talked about that earlier, how to do it standing up and how to do it using the wall as a guide. So very similar when we do it this way, lying on the floor. So this is how we find neutral pelvis. We're going to get our hands like so, thumbs together, fingers together, and we're going to place the thumbs on the belly button and these fingers down here on the pubic bone. Okay, so we're going to maybe do 8-10 reps of this, and just get used to how much movement you have in your pelvis, and how to slowly do the movement and how to control it properly. So when we're starting off, we'll have small, I suppose, arch in our back. So when we rotate, let's say this way, so we talked about this earlier, this is the posterior pelvic tilt. We're going to rotate one way, and that's going to flatten our back into the mat. So that's all the way rotated one way. And when we rotate the other way, which is going that way, you notice that your kind of thumb is higher than your fingers, and that's an anterior pelvic tilt. That should lead you to have a big arch in the back when you put your hand back like so. So again, breathing in, flatten into the mat, breathing the other way, creating a big arch in our back, flatten into the mat, big arch, breathing as we do it. All the movement is coming from the pelvis, so we're just rotating one way, rotating the other way. And as we're doing that, we're just getting used to how much movement is in our pelvis, one way and the other way. And we just want to find that 50-50 midpoint. So when you do find it, you'll find that when you look down your hands, it's kind of, you're pretty much in a flat position. And if you put your hand in there, you'll be able to fit in a couple of fingers, and you'll notice that you have a tiny arch there. So you're not flat into the mat, and you don't have a big arch where you can kind of fit your hand in. you just have a small arch, and that is 50-50 pelvic neutral. So that is the position. Any of those floor exercises that we did the last day, when you're doing them, this is the position you want to be doing them in. Okay? So next up we're going to have a look at, we look at the shoulder bridge. So this is a nice exercise to get a bit of movement into the spine and get you used to how much movement is in the vertebrae up along. And we're going to do this. It's a good exercise also to practice your breathing and get used to how to breathe properly. So when we're doing the exercises, you have to be able to breathe properly. It's not a case of kind of doing maybe 3 or 4 reps with your breath held and then kind of exhaling and doing a few more. We want to be breathing throughout. There's some exercises where you have to it's best to breathe a certain way, and there's other exercises where you can breathe in or out how you see fit, but as long as you're breathing, that's the main thing. So again, lying on the mat, let's say our knees shoulder width apart. Again, you can just practice the pelvic neutral and find that you're in a neutral pelvic position, so you'll have a small arch there starting this exercise off. So as we breathe in, we're going to flatten our back into the mat, so you're just going to rotate that way, flatten your back into the mat, and as you breathe out, you're going to lift up one vertebra at a time until you're in a position where it's kind of a straight line going between your knee, your hip and your shoulder. So don't go up too high where you're arching up like that, and don't go too low where you're kind of sunk down here. Just what about midway between the two, and kind of a straight line going between the 2 points. When you're up in this position, take another deep breath in, and then you're going to roll down, and let's say this vertebra is going to go first, then the next one, then the next one, the next one, all the way down to the bottom. So again, we're back in 50-50 position, small arch there. Deep breath in as you flatten your back into the mat, and as you breathe out, lift up one by one. Nice and slow, just feel the movements in each level. Deep breath in at the top, and as you breathe out, lower down into the mat. Top vertebra first, then the next one, until you reach all the way down to the bottom, and then roll back into a 50-50 neutral pelvic position. So again, you have a small arch there, and that is your starting point. So once more, breathing in, flatten the back into the mat. As you breathe out, lift up one by one. Breath in, and as you breathe out, roll down. Top first vertebra first, and all the way down to the bottom. So that's a nice exercise to get a bit of movement into the spine and how to practice your breathing. So as you saw, there's a nice breathing pattern there which is easy to do. Practice that, and that'll help you when we're doing more difficult exercises. That'll help you get a better breathing pattern for them. The last exercise we're going to look at is the 100. So again, this is done in lying in your back position, the supine position as it's called. So again, the legs are in the same position. Let's say the knees shoulder width apart. You'll notice a small gap there when you look between your legs. You can see down the hole. So again, we're in a 50-50 position, so you can practice that over back, find a neutral pelvic position. And for this one now, we're going to contract our pelvic floor before we do the exercise, okay? So this is the one, we're kind of combining a couple of movements. That's the other exercise that we did, are kind of warm-up exercise, and they help you find neutral positions and getting a bit of movement into the spine. This is kind of the first proper exercise that we're going to do. So when we're doing this, we're going to you might want to take a few moments to practice contracting the pelvic floor while lying down. So gently breathing in and breathing out and relaxing. Breathe in and you'll feel the muscle contract, and breathe out. You feel it totally relax. So do that in and out maybe 5, 6, 7 times. Get used to that sensation. Just breathing in, you'll feel it tensing up. When you breathe out, you'll feel it flattening out and relaxing. And let's say, then we're going to try and add movements to this, okay? So as we breathe in, we're going to contract the pelvic floor. Then I want you to brace your abdominal muscles. So what I mean by that, if somebody basically, if you going to get somebody to kind of punch you in the stomach, if you ask them, say, let's say, punch me in the stomach, you would brace your abdominal muscles. You wouldn't suck your belly in, you wouldn't push it out. You kind of tense up and you kind of just tense those muscles. So when we're going to do this movement, we're first going to gently contract the pelvic floor, then we're going to brace our abdominal muscles, and then we're going to move. So for a lot of these exercises, that's the kind of sequence that we're going to do these in. So you're kind of, with the pelvic floor, that's the very deep muscle. We're going to contract that first, then we're going to contract the bigger muscles, kind of tense them up so we can end up with a nice solid core. So when we add movement to it, we're in a nice solid position, and then we're going to, after we do the pelvic floor, brace the abdominals, then we're going to add movement. So lying back again, 50-50 position, hands over your side, gently contract the pelvic floor, brace your abdominals, and slowly bring yourself into flexion, okay? So when you do this, you're kind of staring straight ahead down the hall, and I want you to imagine this, when you're coming up into flexion, that somebody's kind of pulling on your t-shirt and pulling you upwards. So it's not a case of you kind of pulling your head up, it's more somebody, you're tensing these stomach muscles and they're dragging you upwards as opposed to you kind of lifting and craning your head. So when you do this exercise, the head should feel very light, you shouldn't feel any major tension in the head. If you are, just relax back into the start position and do it again. So we're going to add all these bits together and do the exercise. So deep breath in, contract the pelvic floor, brace the abdominals, and as you breathe out, bring yourself up to flexion. You'll notice that your shoulder blades are lifted off the ground. You're staring straight ahead, your stomach's nice and tight, your pelvic floor is contracted, and you're breathing in for a count of 5, and out for a count of 5. In for 5, and out for 5. When you do this, the hands are slowly, they're just hovering above the ground. You're kind of reaching away towards your feet, let's say, down to the opposite end of the hall. And the hands are light, they're not kind of feeling heavy, or they're not moving about the place. It's all nice and relaxed. And you're just nice solid core, and you're breathing throughout. So maybe try just breathing in once, out once, maybe a couple of reps each way, then relax down and do a couple of reps of that. Eventually we'll be doing it where there's like 10 breaths in and out, so that's why it's called 100. So all those numbers will add up to 100. So give those exercises a go, take your time doing them, and just get used to doing them. And if you have any questions, you can ask me next week. Alright, thank you.